All right, good afternoon. Here is a really exciting session with Dr. Abrams on a topic that many wonder about, cannabis and cancer. So let's get started with you today, Dr. Abrams. Good afternoon.
Good afternoon.
So many cancer patients use medical marijuana or cannabis in their regimen of integrative supplements. So let's start with, is it marijuana or cannabis?
It's a great question, and it's been politically charged very recently, having to do with racism, etc. But I think the answer to the question is cannabis is the Latin name for the plant species that contains cannabis sativa and cannabis indica. The plant has 450 or 500 different chemicals in it, of which about 150 are so-called cannabinoids. And the most famous cannabinoid is delta-9 tetrahydrocannabinol, or THC, which gets people high. It's the most psychoactive component of the plant. So marijuana is best used as a name of these cannabis that includes delta-9 THC. On the other hand, hemp is the name of a plant that contains less than 0.3% tetrahydrocannabinol. So I think they're both right.
All right. All right. Thank you very much. So let's talk about the medical use of cannabis, especially for cancer patients. What are the reasons for cancer patients to consider use of cannabis?
So cannabis is a botanical that's been around and used as medicine for millennia. It's only been demonized in this country since 1942, when it was removed from the U.S. pharmacopoeia. But prior to that, physicians could prescribe cannabis to patients. We know that cannabis is useful as an anti-nausea medicine. The main component, again, the delta-9 THC, has been licensed and approved as a medication, dronabinol or nabilone, and has been available to patients since 1986. So if the main ingredient in cannabis is licensed and approved for treating chemotherapy-induced nausea, you would think the plant itself would be useful as well. And certainly in my experience, it is. Unfortunately, data is lacking in the published medical literature because of the restrictions against cannabis. In this country, it's considered a Schedule I substance, which means high potential for abuse and no accepted medical use. And it's very difficult to get funding to do a clinical trial to look at the potential therapeutic effectiveness of cannabis. That being said, it works for nausea and vomiting. I have many patients who forego standard anti-nausea meds and treat themselves with cannabis. Cannabis is also the only anti-nausea medicine that also increases appetite. And that's also important for cancer patients, many of whom lose weight before their diagnosis. Probably the main reason that we have receptors, so-called cannabinoid receptors in our brain and throughout our body, is because we make our own endogenous cannabinoids called endocannabinoids, like we make our own endorphins. And probably the reason for that whole system is to help facilitate our response to pain. So we do know that, and some of the most convincing support in the medical literature is that cannabis and cannabinoids are useful in decreasing pain. In fact, I'm just printing an article right now that I saw in the medical literature. Newly diagnosed cancer patients in states where medical marijuana is available have decreased use of opiates. So cannabis and opiates can work together, probably synergistically, so that 1 + 1 = 5 instead of 2 in relief of pain. So nausea, vomiting, appetite, pain, sleep is a big one. Many patients have difficulty with sleep, and cannabis, particularly cannabis indica species, are known to be soporific or make people sleepy. And then there's anxiety and depression, which also our patients may experience. And cannabis for some patients is useful for either one or both of those. On the other hand, some patients do have a dysphoric reaction or get paranoid when they use inhaled cannabis. Well, and let me just say that, for those symptoms, doctors can prescribe 5 or 6 different medications, all of which may interact with either each other or the cancer treatment that the patient is getting, whereas we could just recommend one botanical. And it is something that patients, in fact, can grow themselves, and that is often very empowering.
Okay, so thank you for sharing that. It looks like there are quite a few therapeutic benefits that you've seen where it works. Are there scenarios where you would be concerned that it may not work and people might be taking it for the wrong reasons?
Well, certainly one thing that I see here in San Francisco are people that are paying a lot of money for highly concentrated oils of either THC, cannabidiol, which is CBD, or some extract of marijuana itself to treat their cancer. I don't think there's any good evidence in the scientific literature that cannabis treats cancer or cures cancer, as people are even claiming. I think that's very disturbing, and I don't recommend that people use cannabis to treat their cancer. We have treatments for many cancers, and the problem is that taking highly concentrated oils of either THC or CBD can interfere with the system in the liver that breaks down pharmaceutical medications, to the point where maybe those pharmaceuticals could reach too high a level in the bloodstream and become more toxic than the prescribing physician means them to be. So I think that's a caution. I also caution older people with heart disease to be careful using cannabis, because cannabis can increase the heart rate and can lower or raise the blood pressure. And this could be a problem, particularly when people change from sitting to standing or lying to standing. They could get hypotensive and fall down. And older people, we don't want to fall down and break their hip, because that could be a terminal consequence. People who have had a bad reaction to cannabis in the past also are people that I often recommend be cautious. I'm also thinking that inhalation gives people better control over the onset, the depth, and the duration of the effect. Many people take edibles or gummies, and when you ingest cannabis orally, the delta-9 THC, when it goes through the liver, gets broken down into an even more psychoactive metabolite, which is why people get more zonked, if you will, when they eat cannabis than when they inhale it. When you inhale it, the peak concentration in the plasma of the THC occurs in 2.5 minutes. When you take it by mouth, it's 2.5 hours. So again, if you want better control over the onset, the depth, and the duration, inhalation, I think, is better than oral ingestion. Now there are many tinctures. So a tincture is a liquid that you put in your mouth and hold it under your tongue for a few seconds and then swallow it. And so under the tongue, you get some absorption immediately that reproduces or inhalation. And then when you swallow it, you get oral ingestion. So it gives you like a hybrid kinetics between inhalation and oral ingestion. And tinctures are what I'm recommending to most of the patients I see.
Excellent. What about CBD? That's been very popular, especially since some recent regulation changes. And you talked about the highly concentrated CBD, you touched on it. So what is your opinion on therapeutic efficacy of CBD only, especially for cancer patients?
Yeah, I'm not a huge fan of cannabidiol. I think it really glommed on and became a $23 billion a year business because it's not psychoactive. Well, people who claim that CBD does something say it decreases anxiety and helps with sleep. So that to me seems psychoactive. What we mean is that it doesn't get you high. And for some reason, we fear being high in this country. We look upon it as something that you shouldn't do. And that's why CBD has become so popular. There recently, again, was published in the oncology literature a fairly large study of patients receiving CBD or placebo with advanced cancer who are getting palliative care. And the study demonstrated, with multiple different endpoints being examined, CBD did nothing compared to placebo in taking care of symptoms, anxiety, depression, quality of life in these patients. I'm not a fan of CBD, and I think CBD, one of the reasons it's present in the plant is to decrease the high produced by the THC, and it also decreases some of the therapeutic benefit that THC provides. So THC or CBD is not my friend.
Okay. So back to the overall cannabis topic. Any other risks? You've covered quite a few already. Any other risks you'd want to highlight in closing?
There is no increased risk of lung cancer or head and neck cancer, two cancers that are predominant in people who smoke tobacco. There was a suggestion of an increased risk of testicular cancer, but it's really who smokes cannabis, young men. Who gets testicular cancer, young men. So it's a statistical association, but it's not implying causation. It's like there are more drowning deaths in months where ice cream is overconsumed. True, and unrelated. Oncologists often fear that cancer patients are going to get a fungal infection in their lungs. I've been an oncologist for 39 years in San Francisco, where I venture to say many of my patients have inhaled cannabis, and I've never seen that fungal infection. There is some literature that suggests that patients on immunotherapy, the new checkpoint inhibitors that we're using more and more in cancer, have decreased response to those treatments in shrinking their tumors and may have impaired overall survival. I think if you look at these studies, which are not prospective randomized placebo-controlled, but retrospective observational studies, what might account for the difference in survival seen is the difference in the baseline characteristics of those patients in Israel who choose to use cannabis with their treatment compared to those who don't. Often they have more advanced disease, and that could be what's dictating the decreased survival and not the use of cannabis. I believe cannabis is extremely safe and quite effective.
Thank you, Dr. Abrams. That was a very, very educational lecture today, and we look forward to talking to you again.
My